Having to advocate for myself like my whole life made me realize that nursing was perfect for me because the role of a nurse is to advocate for their patient. It's not too much of a burden for someone to meet you where you are. My name is Njingang, and I'm a sophomore nursing student here at the University of Pennsylvania. My summer coming into Penn, I did the pre-freshman program, and Dean Tony actually came and talked to us. And one thing that really resonated with me was, like she said, like there's not like a lot of people that look like us in the healthcare field. So it really put a good picture in my mind about what my experience at Penn would be like. And she kind of introduced me to IBX and the Mazzoni Center. I got the internship, so it's been really great working with her and having her as like a mentor.
The internship program of the Independence Blue Cross Foundation is one that takes nursing students and embeds them in community-based settings to learn not only about nursing and healthcare, but also to learn about community. What surprised me about Leslie was that she had just finished her freshman year. And she had an impact that was so aligned with her personal story and history, and she found in the summer internship a way that she could make a difference.
Hi dear, how are you feeling today? My personal journey, I was born with a hearing loss, and from an early age, a couple months old, my parents had the resources to give me hearing aids and kind of take me through the oral communication route. I had speech therapy, learning how to use my hearing aids. Knowing ASL, we had a walking patient, and I was able to help communicate to them to kind of help them feel more at ease. And being able to be that person was a really meaningful experience to me.
The main reason I went into nursing was to help give a voice to Spanish speakers in the healthcare setting. Working here with Puentes de Salud showed me an opportunity that I wanted to see in nursing. The ability to talk to my patient in their first language, Spanish, helps me connect with my patients, and it makes me feel like I am serving and going into nursing for why I got into it.
I knew José pretty well as a student, and I think both of us found in nursing a commitment and a way to give back and to serve our Latino community.
My time at Puentes taught me that there exist resources to help the underserved in the community. I was working as a med-surg nurse, and I worked with a patient who I was live translating to the social worker about how he had to go back to Mexico to get evaluated for his surgical intervention, and I thought, this doesn't seem right. So I called the head nurse here at Puentes, and she said there's actually the emergency medical services grant. Luckily, he was able to proceed with getting evaluated here in the States for free, and I wouldn't have known that if I hadn't had this experience at Puentes.
We need to develop nurse leaders, and the internship at the Independence Blue Cross Foundation gives students an opportunity to see how nurses and systems work to improve health for those communities.
Tengo mucho orgullo en ser un enfermero. Cuidar a otras personas como si fueran mis abuelos, mis propios padres. Hacer eso para otros día y día es lo que me retiene en esta profesión.
I think the IBX Foundation has helped me to become a better future nurse by giving me more tools and skills that I can use in my future journey. You're going to meet people who have lived different lives than you. And if you don't know how to care for people who don't look like you, who don't believe the same thing as you, then you're not able to properly advocate for the patient. And I want to be that nurse for someone, and just that they can say that they felt cared for and that they felt that I really valued them and really wanted them to get better.